One of the most common things we see in the clinic is pregnant women presenting with neck or upper spine pain. Very, very common. The main reason we see it is because of all the posture changes that happen during pregnancy. So obviously the breasts get bigger, and as the bump starts to get bigger, it changes the way our spine is. And you can sometimes get a forward poking posture, particularly if you're a desk-based worker. The shoulders can start to round then as a result of that, and it puts pressure through the spine. It's very important as well, if you have a history of neck pain or upper spine pain before you were ever pregnant, to make sure that you deal with this quickly, because obviously if you've got some predisposition to it, it could progress quicker during your pregnancy because of all these postural changes. So what we always look at then, again, depending on how pregnant you are, we're going to treat you very differently. If you're only 15 or 16 weeks, you'll still be able to lie on your tummy for treatment. Somebody who's 35 or 36 weeks pregnant with neck pain, we'll have to treat them in sitting. So don't be worried about that. A lot of people feel, well, how can they treat me? They've had previous treatment on their tummy, and obviously they think, how can they treat me when I have this bump? We can treat you, we can tailor it exactly towards the actual stage in the pregnancy that you're at. So we look at trying to mobilize the joints. Usually you get a locking up of a joint, or you get a little bit of muscle spasm as a result of a position that you're in with the postural changes. We'll try and work on those. We'll loosen out the joints, we'll loosen out the muscles, and we'll give you some safe postural exercises to do that will help to keep you on track for the rest of your pregnancy. We'll advise you on pillows when you're in the bed sleeping. Again, it's very important to make sure that you're well supported in the bed and in the bump, because a lot of people don't put a pad under the bump as the bump gets bigger and bigger, and there's the weight of that bump then pulling through the spine, which can be part of the problem. We'll always advise you on heat and ice, that type of thing. Heat is usually very good for this type of neck pain. So all in all, it's very easily treated, but it's very important that you present for treatment. Don't just think that it's part of being pregnant, and don't just think, oh, once the baby's here, I'll be fine. These things are very important to nip in the bud, because any spinal pain will certainly get worse when your baby is here, because you'll be thinking then about feeding positions, changing the baby's nappy, lifting maxi cozies in and out of cars, buggies out of the boot, that type of thing. So any postural pain, any spinal pain, you do need to deal with it as quick as you can.